Good afternoon. I'm Mark Bryant, the Public Information Officer for the Mobile County Health Department. I'm here today to deliver our 2:30 update on Facebook Live. Thank you for joining us today. Unfortunately, I have to start this one with some sad news. We reported this morning that the second Mobile County resident passed away from COVID-19 coronavirus. The individual was a 74-year-old male. He had a history of underlying medical conditions. He had presented to the hospital with known COVID-19 symptoms and was hospitalized. This is from Dr. Eichel, our health officer. We are sad to report our second death in Mobile County. The patient was a 74-year-old male with known COVID-19 symptoms and had other underlying medical conditions. The Mobile County Health Department team is conducting case contact disease surveillance of individuals who have tested positive for COVID-19. Merchants should limit the number of customers in their stores and have markings and checkout lanes for 6-foot spacing. Everyone should take this illness very seriously and keep persons infected in their thoughts and prayers. Along with that, we have said people have been asking for information about the people who have been affected here in Mobile County. Now that we've reached that 50-person threshold that was needed for this demographics, we have some new numbers. This information is of March 31st. The number of patients confirmed in Mobile County at that time was 52. 12 of those have been hospitalized, which is 23.08%, and 2 have now passed away, which is 3.85%. For age, 1 is less than 19. The majority are between the ages of 19 and 64, or 71.15%, and greater than 65, or 14. For gender, 28 are female, 23 are male, and 1 was not announced. For race, 25% have been 25 have been African American, which is 48%, 15 white, and then we don't have the information on 12 of the cases. So we had 12 hospitalized, 24 not hospitalized, and 16 we did not have that information. Now for zip codes, for HIPAA regulations, well, I'll explain that. Let me read this statement from Dr. Randy Murphy. She's our epidemiologist who serves as our Bureau Director of Disease Surveillance and Environmental Services. To honor our commitment of sharing information to the extent possible without inadvertently releasing individual information protected by the Health Insurance Portability and Accountability Privacy Rule, which is HIPAA, we will begin releasing characteristics of patients with COVID-19 daily. Due to HIPAA, we are not able to release the number of cases for zip codes with less than 20,000 residents. For that reason, we have for 36608, we have 8 of those 52 cases are there. 36695 were 13 cases, and the other 31 are from zip codes that do not meet that HIPAA cutoff of 20,000. Okay, yesterday, in case you missed it, we announced that they were currently investigating clusters of respiratory illness at one long-term care facility and one correctional facility. Some of the media have asked for more information. Have we seen any other cases? None at this time. And can we identify those sites? And we presently are, because it's still an ongoing investigation. Also on Tuesday, this was Mobile Mayor Sandy Stimpson sent out this information on Facebook. We have seen enough to conclude that the city must take aggressive action to enforce social distancing. So today, we drafted an executive order to limit overcrowding in big box stores. This order, which will go into effect at 7 a.m. on Thursday, is designed to keep essential retailers functioning while protecting you and store employees from transmitting the virus. The order has been submitted to the City Council for their attorney to review and will be posted on the city's website as soon as it is returned to us. The decision to increase enforcement of social distancing is necessary to slow the spread of COVID-19. The Mobile County Health Department applauds the mayor for this, which follows exactly what Dr. Eichel recommended in the news release today. Also on Monday, to repeat again, that the Alabama Department of Public Health is kind of divided their reported deaths in the state uh, by reported deaths and died from illness on their dashboard, their real-time dashboard, to represent the number of individuals who have a positive lab result and are now deceased. To count a person who died from COVID-19, the medical record of the deceased person has to be reviewed by a physician and infectious disease and outbreak staff. Once review is complete, if the death is attributed to COVID-19, the individual will also appear in the died from illness on the dashboard. So reported death totals are cumulative and will never decrease. So as of this morning, we had reached 1,000 confirmed cases in Alabama, with 24 reported deaths, and 17 of those had died from illness. And even though the report I'd given earlier was for 52 from Mobile County, we're up to 53. So that was as I explained, the difference between the two. As of Wednesday morning, the number of negative test results from Mobile County processed by lab is at 513. And according to the ADPH, the statewide number of total tested is 7,774. I think we've gone over all the issues from the questions from the media, but I want to thank the public for reaching out to us, and I want to share this one. It was very nice on Facebook. Most people are visual learners. A visual of 6 feet to help practice social distancing, and they gave these examples. The width of the average car width is from the driver's side to the passenger side on the outside of the car. A sofa, but maybe not a love seat, and the length of a mattress from the head to the feet. So that kind of helps you. The reason we have the 6 foot, what the scientists have determined, COVID-19 coronavirus is spread by droplets when you sneeze. Dr. Eichel had an excellent example this morning. He said, if you've ever breathe, when it's cold and you fogged a window by breathing on it, that's the moisture from your breath. That's where the droplets, if you are infected, that's where the droplets will be. So if you cough or sneeze, you project those droplets out on an average of 3 feet or so away. So 3 feet, that comes up to 6. That's where we work with that. And remember, it's not an airborne disease. It's mostly the sneezing and the coughing that spreads it. Somebody coughs in their hand and they touch something, it's going to be there for quite some time. The proper thing is to try to sneeze into a tissue, get rid of that tissue, or sneeze into your sleeve. And then constantly wash your hands, because if you have touched something, you touch your eye, you touch your mouth, your nose, there's a very good chance you're going to infect yourself with whatever was on that surface. So, wash your hands. Soap and water is even better than the hand sanitizer. But if you're out on the road, you need that hand sanitizer. It's a great substitute, as long as it's at least 60% alcohol. And clean surfaces, especially high-touch areas. Remote controls, doorknobs, anything where you're going to be touching a lot, or a lot of people. If you're out shopping, especially shopping carts, I really like it when the stores have the sanitizing wipes to clean your thing. But remember, please do not flush those down the commode. They are not biodegradable, and malls and all our other wonderful water systems throughout Mobile County are struggling with people flushing the sanitary wipes, and they're clogging our lines. So if you just dispose of them in the trash, but only toilet paper down the commode. So that is everything I have for you today. Please come back at 2:30 tomorrow. We'll try to give you more update. And if you missed this, we'll be uploading it to our YouTube channel, I Love Mchd, where you can get all the back issues of these videos that we've been seeing. So thank you for joining us today.